Hey guys, welcome to my channel. Today's video is going to be on interesting facts about diabetes, so let's get right into it. So did you know that 537 million people around the world have diabetes? That's fact number 1. Fact number 2 is that every 6 minutes someone dies from diabetes-related causes. And fact number 3 is that 1 in 11 adults has diabetes. These are all really shocking facts, and this is why I think it is really important for us to understand what diabetes is and how we can prevent it. So today I'm going to cover some of the key facts about diabetes, who gets it, the different types of diabetes, symptoms, complications, and how we can actually treat and even prevent diabetes. So if you don't know me already, I'm a medical doctor. I'm an A1C certified diabetes educator and a certified diabetes care and education specialist. I am also a patient advocate. I have lived with diabetes for over 20 years. I have type 1 diabetes and I love sharing medical knowledge with you guys. If you like what you see, please make sure to subscribe so you can get notified every time I post new videos. Okay, let's continue. Let's start off with what exactly is diabetes. Diabetes is a disease that affects how your body turns food into energy. This is because your body needs a special key called insulin in order to unlock the doors of your cells so that glucose, which is the main source of energy for your body, can go in. Without insulin, or when there isn't enough insulin or the insulin doesn't work well, glucose stays in your bloodstream instead of going into the cells. Over time, this can cause some damage to your organs. There are 4 main types of diabetes: type 1 diabetes, type 2 diabetes, gestational diabetes, and prediabetes. Today we are mainly focusing on type 1 and type 2 diabetes. With type 1 diabetes, your immune system mistakenly destroys the insulin-producing cells in your pancreas. This means that your body cannot produce insulin at all. With type 2 diabetes, your body either doesn't produce enough insulin or your body becomes resistant to insulin. This means that the insulin your body produces just doesn't work very well. The majority of people with diabetes have type 2 diabetes. In fact, 90–95% of all cases of diabetes are type 2 diabetes. Type 1 diabetes usually starts suddenly and is often diagnosed in children, teenagers, or young adults, but it can develop in anyone at any age. On the other hand, type 2 diabetes often develops slowly and may go unnoticed for a long time. Many people with type 2 diabetes don't realize they have the condition because they don't have any noticeable symptoms. In fact, sometimes type 2 diabetes is only discovered during a routine checkup where your doctor checks your A1C. The next thing I want to talk about is how common diabetes is. Like I mentioned before, 1 in 11 adults has diabetes and every 6 minutes someone dies from a diabetes-related cause. Here in the United States, more than 10 million people have diabetes and don't know it, and 88 million American adults have prediabetes. This means they have higher than normal blood sugar levels, but not high enough to be diagnosed with diabetes. Prediabetes is actually a warning sign that diabetes might develop. People with prediabetes have a much higher risk of developing type 2 diabetes, heart disease, or stroke. However, it's important to know that if you have prediabetes, you can reduce your risk by making simple lifestyle changes like eating healthier foods and being more physically active. Let's talk about risk factors. There are several factors that increase your risk of developing diabetes. First is having a family history of diabetes. This means that diabetes runs in your family. It is important to know that having a family history of diabetes doesn't mean that you will definitely develop diabetes, but it does increase your risk. Second is being overweight or obese. Remember that most of the diabetes we're talking about here is type 2 diabetes, which is strongly linked to obesity, also being physically inactive increases your risk of developing diabetes. Another risk factor is having a history of gestational diabetes or prediabetes. Having gestational diabetes increases your risk of developing type 2 diabetes later on in life. The same goes for prediabetes. If you have prediabetes, you are at a higher risk of developing diabetes. Also, certain ethnicities have a higher risk of developing diabetes than others. For example, African Americans, Hispanic Americans, American Indians, and Alaska Natives are at a higher risk of developing diabetes than Caucasians. Let's move on to signs and symptoms. Some people have no symptoms at all. Others may experience a group of symptoms known as hyperglycemia. Hyperglycemia symptoms. Hyperglycemia means high blood sugar. When this happens, your body tries to get rid of the excess glucose through your urine. This may cause you to urinate more frequently, especially at night. You may also feel thirsty more often because when you urinate more, it can cause your body to become dehydrated. Other symptoms of hyperglycemia include increased hunger, fatigue, blurred vision, headache, slow healing sores or cuts, frequent infections, numbness or tingling in the hands or feet. Keep in mind that these symptoms are not unique to diabetes. They can be caused by other conditions as well, so it's important to see your doctor if you have any concerns. Moving on, let's talk about diabetes complications. Untreated diabetes can lead to serious complications over time. These complications can affect almost any part of your body. One of the most common complications of diabetes is nerve damage. Nerve damage can cause numbness, tingling, burning pins and needles sensations, weakness or pain in your hands or feet. Diabetes can also cause problems with your eyes, kidneys, heart and blood vessels. It can also cause skin problems, hearing loss, and affect your mental health. Now I want to talk about diabetes testing. There are 3 main tests used to diagnose diabetes. The first test is a fasting plasma glucose test. For this test, you have to fast for at least 8 hours before the test. During the test, a sample of your blood is taken from a vein in your arm. Your blood sugar should be less than 100 milligrams per deciliter or less than 5.6 millimoles per liter. The next test is the oral glucose tolerance test. For this test, you will drink a sugary liquid, and then your blood will be tested several times over the next 2 hours. After you finish the sugary liquid, your blood sugar should be less than 140 milligrams per deciliter or less than 7.8 mole per liter. The third test is the A1C test. With this test, a sample of your blood is taken from a vein in your arm. With this test, your average blood sugar levels over the past 2 to 3 months are measured. An A1C result of 6.5 or higher than 6.5 is considered diabetic. An A1C between 5.7 and 6.4 is considered prediabetes, and an A1C of 5.6 or lower is considered normal. I have an entire video on the A1C test if you want to learn more. Now I want to talk about diabetes treatment. Treatment of diabetes depends on the type of diabetes you have. For type 1 diabetes, treatment always includes taking insulin either by injection or with an insulin pump. Sometimes oral medications can also be used. With type 2 diabetes, treatment may include healthy eating, physical activity, weight loss, oral medications, and/or insulin. And now for the last part of this video, I want to talk about how to prevent diabetes. So let's first talk about prediabetes, because we can actually prevent prediabetes from turning into diabetes. This is done by making simple lifestyle changes like eating healthy, exercising more, losing weight if needed, and getting regular checkups. Now, if you already have diabetes, there are things that you can do to prevent complications from occurring. The first step is to control your blood sugar levels. This can be done by following the treatment plan that you make with your healthcare team. Also, it's important to see your doctor regularly for checkups and screenings. This is because diabetes can cause complications that may not have symptoms. Regular checkups can help detect complications early when they're easier to treat. Finally, you can prevent diabetes complications by making healthy choices. Eat a balanced diet full of fruits, vegetables, whole grains, and lean protein. Be physically active for at least 30 minutes most days of the week and maintain a healthy weight. Alright guys, that's the end of today's video. I hope that you learned something new. If you did, please make sure to hit the like button. This helps my channel tremendously and it helps me reach more people with diabetes. Also, if you have questions, please leave them in the comments section below. I try to answer all of the comments and messages that I get. Thank you all so much for watching and I will see you next time. Bye.